So good day, so I'm Hain Batara, and for today's procedure, I'm going to demonstrate the donning and removing personal protective equipment, which is the gloves, gown, mask, and eyewear. So personal protective equipment is a protective and specialized clothing used by healthcare providers or employees for safety risks and protection against infectious agents. So PPE is an equipment used to protect user or wearer against health risks at work. It protects both the healthcare workers and patients from transmissible pathogens by preventing exposure to bodily fluids and respiratory droplets. Another importance of PPE is that it helps minimize the spread of COVID-19 from one person to another. So, the equipment that we will need is the clean gown, the surgical mask, the face shield, the disposable gloves, the bonnet, and the shoe cover. Also the alcohol. So the first procedure that we're going to do is we have to prepare the necessary equipment and supplies. Prepare for an orderly procedure. So here is the equipment. Second is wash your hands. This is to avoid the transmission of pathogens. So don a clean gown. So pick up a clean gown and allow it to unfold in front of you. Then slide the arms of the hands through the sleeves. Fasten the ties at the neck to keep the gown in place. Overlock the gown at the back as much as possible and then fasten the waist, ties, or belt. So overlapping securely covers the back of your uniform. Don the face mask. So locate the top edge of the mask. Then hold the mask by the top two string or loop. So place the upper edge of the mask over the bridge of the nose and tie the upper ties at the back of the head or secure the loops around the ears. Then secure the lower edge of the mask under the cheek and then the lower ties at the nape of the neck. If the mask is a metal strip, adjust this firmly over the bridge of the nose. So wear the mask only once and do not wear any mask longer than the manufacturer recommends or once it becomes wet. Do not leave a used face mask hanging around the neck. So this is for an effective procedure. A face mask should be covered both nose and mouth because the air moves in and out. A secure fit prevents body escapes and inhalation of the microorganisms around the edges of the mask and fogging of the eyewear. So, don clean disposable gloves. Pick up the clean gloves using the left hand and properly insert the right hand. Then, glove the left hand. Move the gloves up to cover the cuffs of the gown. So, This is to protect the hands from microorganisms and contamination, to protect both nurse and the patient from the transmissible pathogens. Putting an eyewear or face shield. So, wear a protective eyewear by snugly fitting it to cover both eyes. So, wear face shield making sure to cover the entire face. So, this is to protect the eyes and nose from impact hazards. So, to remove soiled personal protective equipment, remove the gloves first before they are the most soiled. If wearing a gown that is tied at the waist and front, undo the ties before removing gloves.
First and foremost, you have to assess the patient's skin and then you have to assess the patient's skin and for you have to make sure you are prepping the right surgical style causing harm.
So, remove the first glove by grasping it on its palmar surface just below the cuff, taking care of to touch only glove by glove. So, pull the first glove by completely off by inverting or rolling the gloves inside out. And then continue to hold the inverted removed glove by the fingers of the remaining glove hand. Place the first two fingers on the bare hand and inside the cuff of the second glove. Then pull the second glove off the fingers by turning it inside out. This pulls the first glove inside the second glove. Using the bare hands, continue to remove the gloves which are now inside out and dispose them in the waste container. So, wash your hands. So, this is to avoid the transmission of the microorganisms.
So first,
Remove the protective eyewear or face shield and dispose of properly or place in the appropriate receptacle for cleaning. So, to remove or wash off the microorganisms and prevent contamination.
it includes, it includes the shaving of the operative side.
So, remove the mask. If using a mask with string, first untie the lower strings and then untie the top string. Hold the ties securely and remove the mask from the face. So, if using a mask with ear loops, and hold the ear loops of both ears securely and remove the mask from the face. So, discard the disposable mask in the waste container. Then wash the hands again if they have become contaminated by accidentally touching the soiled part of the mask. So, the front of the mask is considered contaminated and then must not be touched. Mask should be disposed properly to prevent the spread of the pathogens. So remove the gown when preparing to leave the room. Then avoid touching the soiled part in the outside of the gown. If possible, grasp the gown along the inside of the neck and then pull down over the shoulder. Roll up the gown with the soiled part inside and then discard it in the appropriate container. So you might contaminate it. So proper removal should be done.